I'm Ed Schlesinger, the Benjamin T. Rome Dean of the Whiting School of Engineering. Even before we understood the impact COVID-19 would have on just about every aspect of the university and on our lives, Johns Hopkins engineers were laying the groundwork for research that now is guiding the world's understanding of the pandemic and launching life-saving innovations. Just 2 weeks after the first deaths from COVID-19 were reported in China, civil and systems engineering professor Lauren Gardner with doctoral student En-Sheng Dong launched a real-time interactive COVID tracking map that soon became the world's leading source for pandemic data. The dashboard they built has come to define our understanding of COVID-19's spread and impact, and governments, health organizations, and more now rely on it to inform global health policy and effective practice, an achievement that led to Gardner being named one of Time's 100 most influential people of 2020. Immediately after shifting to remote operations, Johns Hopkins engineers committed themselves to addressing the most urgent health-related challenges posed by COVID-19 as they were still emerging, like shortages of medical equipment. They created a ventilator splitter that can double capacity for treating patients with acute respiratory distress syndrome, and developed models to help overburdened hospitals better manage critical resources and stay ahead of COVID-19 surges. Because understanding and mitigating risks posed to individuals and to those that could impact entire populations would be critical to managing COVID's spread, our researchers built a robotic system that can remotely operate ventilators, thereby limiting frontline healthcare workers' exposure to the virus. They created a model to quantify the risk of COVID-19 transmission in different settings, such as on an airplane or in a gym, combined with other variables like mask wearing and social distancing, and a model that can predict with 93% accuracy the occurrence and timing of sudden cardiac death in patients with COVID-19. They discerned how genetic diversity in virus strains can impact disease transmission, immune response, and pharmacological resistance. And they analyzed social media data to better understand and combat the spread of misinformation about COVID-19. Pioneering interdisciplinary research that improves the human condition is not just what we do at Johns Hopkins Engineering, it's central to who we are. And we are committed to advancing understanding of COVID-19, to mitigating its effects, and to sharing our knowledge with the world.